Good afternoon. I'm Tammy Epps, and I'm the Director of Media Relations and Social Media at Prisma Health. Thank you for joining us today. We're here today to talk about a topic that probably a lot of people have been talking about, HPV. So here at Prisma Health, our goal is to make sure that we provide our community with the kind of information that will impact them. We spend a lot of time making sure that you have the information you need to keep you safe and well. So HPV Awareness Day is Saturday, March the 4th. And at Prisma Health, we wanted to inform our community about the importance of HPV screening and vaccination to help prevent cervical cancer. I know that a lot of parents also have questions about whether they should provide the HPV vaccine to their children or not. So we have our experts here to answer your questions. So we are happy to say that our panel today includes Dr. Benjie Mills, who's a pediatric and adolescent gynecologist in the Upstate. Dr. Jill McLeod, who's an OBGYN here in the Midlands. And Dr. Divya Ahuja, who's one of our infectious disease physicians in the Midlands. And with that, we also are welcoming to our media partners who have decided to join us today to also help us get this information out to the community. We appreciate them joining us for that purpose. So with that, we're going to start with some general questions to our panel. We're going to start with Dr. McLeod. Dr. McLeod, thank you for joining us today.
Hey, thanks for having me.
So we're going to start with a simple question first. So for the community out there, kind of tell us what HPV is and how does a person get it?
So HPV is a human papillomavirus, and it's actually the most common sexually transmitted disease. It can be transmitted by vaginal, oral, or anal intercourse.
All right. With that, we're going to go to Dr. Mills. Thank you, Dr. Mills. So Dr.
Thanks
McLeod,
for having me.
Thank you for spending the time. So Dr. McLeod told us a little bit about what it is and how people get it. Are there symptoms of HPV?
Well, not really, because most people who have HPV have absolutely no symptoms. It's really only after someone gets invasive cancer of the cervix, the vagina, the anal area, or the vulva that they start having symptoms, which most commonly are abnormal bleeding from the area or having a rough scaly patch that gets a little ulcer in it and just never heals up. So for the most part, the people who do have HPV actually have absolutely no symptoms. So that's why it's really important to get screened for the disease.
And with that, we're going to go to Dr. Ahuja. Dr. Ahuja, so we've heard a little bit about what HPV is, how people get it, and some of the symptoms. What types of HPV lead to cancer?
Good question. And my colleagues have already sort of laid the foundation for this, but there are certain high risks. So HPV is so common, all of us are infected with it. But there are many different types of HPV, and we get infected and it gets better. And 9 out of 10 people, they will not progress to anything serious from this infection. But a small minority will go on to progress. And as my colleagues have mentioned already, that it can cause all sorts of complications, and we talk about that. But to answer your question, there are over 200 different types of this virus. There are, however, certain high-risk ones, 14 or 15 high-risk ones that are more likely to cause cancer. And fortunately, a lot of those high-risk types are included in the vaccine. So yes, there are high-risk types that cause cancer, and then there are a couple of others that are more likely to cause just warts without cancer. But once again, we should talk about the vaccine. Sort of every few minutes, we should mention the vaccine in this forum, because that's really that's one way to get rid of this. But does that answer your question, or was that a roundabout way?
No, that's good. Okay, so you said it, I think throat cancer was on that list. So does it specifically cause throat cancer?
So, my gynecology colleagues will speak to the cervical cancer, but more than 90% of cervical cancer is caused by HPV. about 70% of oropharyngeal cancer, almost 100% of penis cancers, 100% of vaginal cancers, almost 100%, vulvar cancers, anal cancers. And I just read something on the National Cancer website today that of all the cancers reported in the United States, between 2 to 3% are caused by HPV. So just let that sink in. So of all the cancers in the United States, that includes cervical, this, that, and the other, about 2 to 3% may be caused by HPV. So that's what the National Cancer Association is sort of talking about.
Good, thank you, Dr. Ahuja. We're going to go back to Dr. McLeod. Dr. McLeod, so I think you mentioned earlier about symptoms, Dr. Mills talked about that, but how long does it actually take for it to show up?
So after exposure to certain types of HPV, genital warts can appear after 1 to 8 months of exposure, but you can have symptoms from cervical HPV within weeks, months, or even years after your exposure. So it can be very variable. That's why it's important to continue follow up with your healthcare provider throughout your lifetime.
Right. Thank you. Dr. Mills, the question is can it clear up on its own?
Absolutely. So just like Dr. Ahuja said, about 90% of HPV infections actually are cleared by the immune system. And so the good news is that for patients who are healthy, who are not immunocompromised, such as having HIV or organ transplant, these infections just go away and they don't need treatment. In patients who actually do need treatment, though, that other 10% of patients, we can surgically or chemically remove the HPV areas, but we can never guarantee that we get every little viral particle. And so close follow-up after we treat HPV lesions is really super important.
Thank you. So Dr. Ahuja, we hear a lot about women and cervical cancer, but I know you mentioned men and cancers that's specific to men. So how dangerous is HPV for men?
Like I said, it's so think about it, when we talk about women getting cervical cancer or different kinds of malignancies from this virus, but it is a sexually transmitted virus. So obviously both men and women are equal partners in this battle against HPV. And that is why it's even more important that all children should be vaccinated. And unfortunately, because of various myths and propaganda out there and certain beliefs, our vaccination rate in the United States is less than 60%. When there is a vaccine that can prevent cancer, and you won't let me show slides of the cancers, right? But when there is a vaccine that can prevent cancer, every child should be given that opportunity to get the vaccine before they become sexually active. And it would protect them against so many things. It won't protect them from everything in this world, but at least that's one less thing they have to worry about in their adult life. But yet we don't get vaccinated because of myths and misinformation out there.
Thank you, Dr. Ahuja. Dr. McLeod, so the question is, can men be tested for HPV?
There is no routine screening test for men like there is for women, but a good physical exam on a man for warts. There is also an anal pap that can be performed on men with high risk factors, such as men who have sex with men. So that can be done after discussions of risk with a man's provider.
Thank you. So back to Dr. Mills, and I think all of you have said this many times, but we're gonna ask the question anyway. What is the best way to protect yourself against HPV? Dr. Mills, you're muted, I think.
Thank you.
You're
So the
welcome.
best way is to get the vaccine. It's approved in the United States for ages 9 to 45 and is highly recommended for all patients. After 26 years of age, it's important to have a discussion with your doctor if you haven't been vaccinated. The other thing is it's greater than 99% effective. And we'll talk soon about the pros and cons of getting the vaccination. But really, we've never quite seen something so effective for such a terrible disease. I mean, this vaccination has been a major milestone in women's health, just like pap smears were when those were invented, or birth control when that was invented. So this is a huge milestone in women's health. The other thing, though, that you can do to help prevent HPV is to not smoke or vape, because smoking actually decreases the body's immune system and its ability to fight off any HPV infection that you get.
Wow, I don't think I've ever heard that before, Dr. Mills. That's really interesting. Let's go to Dr. Ahuja on the pros and cons of the vaccine. So Dr. Ahuja, we know you're a strong advocate for the HPV vaccination. Tell us what pros and cons there are.
So with the pros, I would say that, so back when in 2007 or so, Tammy, when we charged, in Australia, they actually started giving free vaccine, HPV vaccine, to all their school age kids. Within years, in Australia, which is a developed country, they found a significant drop in warts and then subsequently a knock-on effect in cervical cancer and some of these other changes. So the pros are that this vaccine, if given early, if given before the child is sexually active or the person is sexually active, because it works most effectively before you've acquired that virus. So if a person becomes sexually active, they acquire a certain type of high-risk HPV virus. If you give them the vaccine after that, they already have the virus, so the vaccine won't be effective. That is why it's recommended that a child get a vaccine between the ages of 9 to 11 before they are sexually active. And as Dr. Mills pointed out, it can be used up till the age of 26, and beyond 26, there are some risk-benefit discussions with your provider and can be given up to the age of 45, but the benefits are very limited because by that time, because a majority of people have been sexually active, they've already acquired the virus. So it's like shutting the barn door when the horse has already bolted. It's too late. By that time, the horse has left the stable, so to speak. So early vaccination can prevent that child or that young adult from acquiring that virus when they become sexually active and prevent them from getting warts or cancers of all types that we talked about. The cons are that it is a shot. No child likes a shot, no adult likes a shot. So there are reports of children fainting after the vaccine. Any adults faint after vaccine. So just because a child faints doesn't mean it is a bad vaccine. Every child is obviously monitored, and my pediatric colleagues will obviously agree with that kids and adolescents are more likely to faint after vaccine. But just like we do MMR or these other vaccines, this should be part of routine care. But unfortunately, even now, there is a less than 60% uptake in the country. When this is one of two vaccines that prevents cancer. The other vaccine that prevents cancer is hepatitis B vaccine, which every child in the United States is given. So if we have a vaccine that takes away this problem in adulthood, I think every parent should be encouraged to give it to their child. It's a very safe vaccine.
Thank you, Dr. Ahuja. All right, we're going to go back to Dr. McLeod. So I just wanted to add that Dr. McLeod is from our Sumter market. So thank you for joining us from Sumter today, Dr. McLeod. I'm sorry, I missed that earlier to say that. So, all right, Dr. McLeod, And I think Dr. Ahuja was hitting those points already for you about is the HPV vaccine safe, but I'll let you add something to that.
Exactly. The HPV vaccine is very safe. There's been over 15 years of monitoring and research. It's continued to show its safety. There's been lots of studies, over 30,000 females and males in studies that have shown that safety. There's been no correlation with infertility. That's been some of the misinformation that's been out. Really, side effects are redness and pain in the injection site, just like with any other vaccine. So it's proven its safety. And I agree. If there's any vaccine to prevent cancer, why wouldn't we get it? I feel that if there was a vaccine to prevent breast cancer, wouldn't people be lined up around the streets? I just, it's so safe. Everybody should be vaccinated with the HPV vaccine.
All right, thank you. We're going to go to Dr. Mills. Dr. Mills, the question is, okay, so now you have HPV. What can you do to reduce your risk of cancer?
Yeah, so just to spring off of something Dr. Ahuja said, is once you do have a particular viral type, one of those over 200 different viral types, you know, you develop an immune response to that viral type. The thing is, though, the vaccine covers 9 different viral types, and most patients have only been exposed to one during any diagnosis of HPV disease. So we definitely recommend the vaccination, even for people who've been sexually active before, and even for people who have been infected with HPV. So in terms of reducing your risk of cancer once you actually do have an HPV infection, it's super important just to go to all your follow-up appointments, because in most patients, we're actually able just to follow the patient. And again, because of the spontaneous rate of clearance by the immune system, most patients actually don't need treatment. But if treatment is recommended for you, then I definitely recommend you get that treatment. And that's so that we can prevent disease from spreading. The other thing you can do, like I said before, is don't smoke or vape, because it limits the body's immune system and its ability to fight off HPV. And then finally, use any sort of use a form of barrier protection when having sexual intercourse, just to decrease exposure to any HPV that is there.
Okay, so the question from Facebook is, well, you had said earlier if there were symptoms, but you're saying there really aren't any symptoms. Can you address that again, please, for us?
Yeah, absolutely. So most people, we determine they have HPV infection just by routine testing. So they come in, they're doing completely fine. We do a routine test and boop, there it is. However, in patients who are having abnormal bleeding, who are able to see something on the vulva or in the perianal area, for those patients, we definitely want to take a look at what they're seeing and make sure that we don't have an HPV infection that needs to be treated. Those things are much easier to treat when they're early and small than once they get larger and more out of control.
So Dr. Mills, so the question is, are HPV tests better than Pap smears?
Well, this is a debated topic amongst all of us. The short answer, yes. HPV testing is superior to Pap testing alone for detection of HPV infection and disease from human papillomavirus. The thing is that we've been so ingrained to get our pap smears every year. And what we've learned about HPV, because it really is a slow growing virus in terms of the disease process, that we really don't have to do pap smears every single year, which was the recommendation when I first got into medicine. So what we've learned is that if we use one of two approaches, then we'll do a really great job of finding HPV disease. The first approach is to do HPV testing alone. This starts at age 25. It's done every 5 years for women between 25 and 65. If the HPV test is positive, then the lab will run a pap smear on the specimen that was already collected. So that's actually a really great thing. The other way to test for HPV is use of the pap and HPV testing. So the way this screening method works is for women between ages 21 and 29, you get a pap test every 3 years. And then starting at age 30, you get a pap and an HPV test through age 65. So 2 ways to approach it. The HPV test is more efficient. It results in less testing and does a superior job of finding disease.
So I think the best, I guess, advice would be to people. I think all of you have said that, is to make sure that people are following through with their screenings,
Right.
seeing their doctors as they should, and getting advice on when to come in. Because I think that is, I guess, the crux of everything we're saying is make sure you're checking in with your doctor about things.
Absolutely. And many doctors across the country are still really enthusiastic about doing pap testing with the incorporation of high-risk HPV testing. I think that's super important because not all labs across the country are able to do primary HPV testing. It depends on what resources your doctor has available to him or her as to what type of testing is done or offered to patients. Patients who are in more rural areas or more remote areas, that can be really difficult to obtain testing, and also for them to be able to see a doctor regularly. And so there are always some special considerations.
Thank you. We're going to go Dr. Ahuja. Dr. Ahuja, I have a couple of questions for you. One of them being, will HPV ever be able to be utilized in people over the age that we're the 45? Is that something that's being researched, or have you, what information do we have about that?
By the age of 45, like I said, most of us have been infected with a number of the different types of HPV virus that are in the vaccine. So the benefits go down significantly. Should it be an absolute no? There is nothing ever an absolute no or yes in medicine. You know that, Tammy. But in terms of risk benefit, you look at the population that is at risk of getting the infection, and you target that population. Just like with the COVID vaccine, the biggest benefit is in the older people and people with comorbidities, right? In this, the younger people who are more likely to get the virus, they are the biggest target here. Should you be vaccinating a 55-year-old? Yes, it's very possible that they haven't been infected with all the serotypes. But even if they do get infected at that age, it takes decades for the virus to kick in and actually cause changes of cancer. So the short answer is the benefits are very limited if you give a vaccine to somebody who's older than 45, 50. And that is why when the people, CDC and FDA, they do vaccine approval, they look at safety, they look at benefit, and they look at the bang for the buck, so to speak. If you're giving a vaccine to 200,000 people, how many people are you going to, how many of those 200,000 will not get cancer based on the vaccine? And the biggest bang for the buck is in those under 26 and then to some extent those under 45. But the benefits become very, very limited the older we get because we're already infected with it. And as I said, the horse has left the stable, so you're trying to shut the door on an empty stable. Not much point there.
So Dr. Ahuja, the question came in about the fact that I think you mentioned the COVID vaccine and how it was new and there was a lot of people that were concerned about it because it was under emergency use. But this vaccine has been around for a long time. So talk about the difference in that kind of having a vaccine that's been around for a long time.
And I think I can understand anybody having questions about the vaccine or any medical intervention. I think as patients, they should always question us, because after all, they are the ones who are going to be getting the shot or an intervention or a chemotherapy. But over 600 million doses of the COVID vaccine have been given in the US. 600 million. That's almost twice the US population. And the side effects are so few. So when people call it new, I think I would counter that with the fact that some of the chemotherapy medicines that are used for cancer have been tested in 30 people or 40 people or 100 people. Some of the other rare diseases, and yesterday was Rare Diseases Day, by the way, for conditions that are very, very rare, less than 100,000 or so, less than few hundred in the US. Some of those medicines have been tested in 30 people, 40 people, 100 people. 600 million doses have been given in the US. And how many serious side effects from the COVID vaccine? Very few. How many deaths from COVID? Millions. So I wouldn't call COVID vaccine new. It's probably the most tested vaccine in the last 20 years. There are vaccines given around the world in the developing world, like measles, mumps, that have been around for a long time. But around the world, over 12 billion doses of the COVID vaccine have been given. So I wouldn't call it new. It's probably the most tested thing around. And as far as HPV goes, it is a safe vaccine. And my colleagues have already sort of reiterated that point. It is far safer than some of the other things we do. It's probably safer than driving a car. So I would consider that.
All right, so the other question is, can HPV be transmitted through non-sexual contact?
So condoms help, as Dr. Mills pointed out and Dr. McLeod pointed out. Condoms help reduce the likelihood of getting HPV, but they don't eliminate it because HPV is transmitted by direct skin-to-skin contact. So the person could be harboring the virus in areas around the genitals or other parts of the skin. So condoms are good, but they don't completely eliminate the risk of HPV. They reduce the risk of HIV, gonococcus. By the way, Richland County is number 3 in the country for gonorrhea. So we can put that into our sort of Christmas stocking that, we are number 3 in the country for gonorrhea. So condoms help for gonorrhea, chlamydia, HIV, but they reduce HPV, but don't eliminate it completely. So direct skin-to-skin contact is a common mode of transmission.
I'm going to go back to Dr. McLeod here. Dr. McLeod, I guess the question is, are we seeing HPVs being diagnosed earlier? Are we seeing them in your practices? Are you seeing them later? Or what are you seeing as a physician?
I haven't really noticed a difference in age at diagnosis, but I do think that women in general in their 20s are doing a much better job at coming in for routine preventative care than maybe 20-year-olds have in the past. I think that these 20-year-old age groups are more informed and are just really taking hold of their preventative care and their health in general. So I really am thrilled with that. And I think that these 20-year-old ladies are more vaccinated and are doing a really good job at keeping up with their screening. So I'm very hopeful that in the future, HPV will be less. But yes, we do continue to diagnose it every day.
Yeah, I'm gonna go to Dr. Mills. Oh, here's a question. What are HPV genital warts? I'm not sure if that's a question for you or do I need to pass it along to someone else?
No, I can do it. So
Hold on,
genital
Dr. Mills,
warts are,
there you go. Yeah, go ahead.
genital warts are in general caused by two specific virus types, number 6 and number 11. They don't have fun names to them. We just number the virus types. So number 6 and number 11 are the most common causes of genital warts. So what a wart is, it's a fleshy growth on the skin. It's more common on the vulva or the anal area. And it sometimes becomes sore, sometimes it gets traumatized when you're wiping or using the restroom. And sometimes they can actually just get infected with skin bacteria or normal skin bacteria. So warts are something that are unpleasant but easily treated as long as you go to the doctor for it. A lot of people have warts and then they're just so scared to go to the doctor or embarrassed about it or just really, really self-conscious about having warts. But they're actually really easy to treat with either a chemical that we put just right on the wart or with a medication that comes in a cream form. And so warts are just these little fleshy growths and you see them, and if you see something that you're concerned about or you don't know what it is, then we're always happy to look at it.
So with that, we don't have any additional questions. I'm going to go back to all our speakers for one last, any final thoughts on this topic. So since you're on the screen, Dr. Mills, your final thoughts, what would you want to remind the community of about HPV?
Just want to remind everyone that it's common. And if you are diagnosed with an HPV infection, it is not the end of the world. However, it does mean that you need some extra visits. I definitely want everybody to know to come and get their screening testing. And most importantly, get the vaccine if you are qualified to get it.
Okay, with that, I'm going to go to Dr. McLeod. Dr. McLeod, final thoughts for the community on HPV.
Yes, I just want to reiterate what Dr. Mills said. It's so very common. So just come see your friendly neighborhood gynecologist, come get screened, and let's talk about it and get vaccinated.
Dr. Ahuja, I'll give you the final word, things you want to remind people about.
So this is one of those things. First of all, Tammy, thank you for organizing this because it's a very, very common bacterial infection. Number two, it'll sneak up on you. And once it sneaks in, you won't have symptoms for many, many years until you develop problems. Not everybody gets problems, but 10% of people who get this infection may end up with either warts or cancer, even less than 10%, most, but 95% will have no problems. So get vaccinated, get your kids vaccinated because they don't have the say in it at this time. They're still kids. Get all 9 to 11-year-olds vaccinated, get screened for cancer, and when possible, use condoms because they reduce the likelihood of HPV, but they don't eliminate it. And for those of, and don't always listen to Dr. Google. Talk to your doctor because Dr. Google is good, but not always correct. But thank you.
Thank you. Thank you. Thank you to our doctors for joining us today. We had Dr. Benjie Mills, who is a pediatric and adolescent gynecologist in the Upstate, Dr. Jill McLeod, OBGYN in the Sumter market, and Dr. Divya Ahuja, who's an infectious disease physician here in the Midlands. If you have additional questions on this topic, please put them in our Facebook, on our Facebook page, in the comments, and we will try to answer them. Thank you to our media partners for helping us share this important information. As always, if you have any questions about your health, please check in with your primary care physician. Get them to work with you and be an advocate for your own health. If you need a primary care physician, you know, Prisma Health has lots of them. We're happy to help you with that too. So thank you to everyone, and thank you for joining us today. Everybody have a great day.